think we already did this. Is hypertrophy pre-neoplastic or no? Yes. No. Maybe. No. Why not? What about cell division?
No cell division.
Can't divide, can't become neoplastic. Does that make sense? If you were a cell that cannot divide, you cannot make a baby tumor. You have to divide to do that. So hypertrophy is not pre-neoplastic, but all of these other adaptations are pre-neoplastic. All the ones that involve an increase in the number of cells or a change in the identity of the cells. So metaplasia can be pre-neoplastic. Again, remember that these are adaptations, so they are reversible with the removal of the stimulus until we get to this point. So everything above this line is reversible. Hyperplasia, reversible. Metaplasia, reversible. We remove the stimulus. Dysplasia, this is a new one. This is dys means abnormal, like dyspnea is abnormal breathing. I'm having trouble breathing. Dysplasia, so this is abnormal or disorganized growth in adult cells. These are usually cells that are under conditions of extreme proliferation. So there's often hyperplasia and dysplasia. We've been asking these cells to proliferate unreasonably for a long time in a long area. And so there's some disorganization coming, but that is reversible if we remove the stimulus. Once we progress to anaplasia, this is a loss of differentiation of the cell. So it's becoming more like a stem cell than the adult cell type that we need it to be in tissue, right? So it's reverting, it's becoming more primitive and more stemmy, more like a stem cell. Anaplasia is not reversible. When you see anaplasia, it indicates that you have progressed to neoplasia. At that point, it is irreversible. Okay? Anaplasia is a hallmark of malignancy. It's how we know by looking at neoplastic cells that they are neoplastic, because they are anaplastic. They don't look right anymore. They look like stem cells. And then neoplasia literally means new growth. Again, anaplasia, neoplasia, irreversible. Dysplasia, so again, this is abnormal growth. It's a state of disorderly proliferation. So again, it's usually where we're asking cells to proliferate a lot. They're under conditions of hyperplasia. There's changes in cell size, shape, orientation. There's a loss of uniformity. So some cells would get a little bit bigger, some cells a little bit smaller. This was my favorite phrase I found when reading about this. It's architectural anarchy. So a normal epithelial mucosa should have basal cells at the bottom. And then you go up through organized layers until you get to the most differentiated cells at the top, who then die and slump, right? Architectural anarchy is when I have basal cells. Look down here. This is severe dysplasia. This is like all basal cells. Where's the fully differentiated keratinocytes that were right here? They're gone. This is all very STEMmy to me. They look like all basal cells, which are the stem cells of the epithelium. Does that make sense? So the cells still resemble the normal adult cells. I can still tell that these are a squamous epithelium, but oh boy, they are starting to get weird. Again, dysplasia is pre-neoplastic but reversible, often accompanies hyperplasia. Dysplasia is not adaptive. It's not going to help with anything. It's just making a mess and predisposing us to cancer. Okay, so these other adaptations we're talking about, these are actually adaptive. Metaplasia, hyperplasia. Dysplasia, not adaptive. It's like a slippery slope to cancer world. This is a pap smear. This is what they're looking for on a pap smear. They're looking for evidence of dysplasia of squamous epithelial cells. So these are the ones that should be exfoliating. These are the ones that come off and smeared. They should look very mature, right? They're about to slough off. They're basically dead keratinocytes. They should have a tiny nucleus or no nucleus, lots of cytoplasm. If I do a pap smear on this cervical tissue, I'm not going to get these. I'm going to get weird looking, hyperplastic, very active very mitotically active, very large nuclei to cytoplasmic ratio. That's gonna tell me that there is dysplasia in this sample and that I should go in and take a biopsy. So that's what they're looking for in a pap smear, evidence of dysplasia. You see dysplasia on cytology. Histopathology is more sensitive, so at that point you take a biopsy and see what we're dealing with. Are we dealing with just dysplasia, or is this progressed to invasive cancer, right? If we see dysplasia, we know it's at least pre-neoplastic. Does that make sense? So it has the potential to become cancer if it isn't already. So dysplasia is highly concerning. Does everyone still understand this stuff as well as they think they did yesterday? No? What questions do you have? All of these can lead to cancer, but up to here, it's reversible. Everything, dysplasia, metaplasia, hyperplasia, all reversible. If it's under this heading, reversible with stimulus. Anaplasia, neoplasia, not reversible. What else? Technically, yes, but remember, like, we gotta be careful with those terms because people, yeah, I would say it's an mass or swelling, right? When you start using tumor, especially around owners or lay people, they think they're talking about cancer, right? That question was, yeah.
So any have three results, it would have like an adenoma?
Yeah.
Can you have like adenocarcinoma?
Yeah.
Okay.
Yeah, that's a malignant tumor of glandular epithelium, this is adenocarcinoma.
Right, adenoma.
An adenoma is a benign tumor of secretory epithelium. Everybody good with the nomenclature? That's probably the single most important thing in this module is how to name and recognize tumors. So if I give you the name of a tumor, you should be able to tell me it comes from this cell type and it's either benign or malignant. Does that make sense? Go practice? Yes. Salivary adenocarcinoma. Malignant. Of epithelial origin, what cell? Salivary glandular epithelium, it's an adenocarcinoma, right? How about a osteofibroma? It's benign. What lineage is it? It's a benign mesenchymal tumor, and what's the potential cell types of origin? Osteofibroma. Maybe an osteocyte or a fibroblast, can't tell because I did something weird, right? One of those. How about what's hard? How about no, that's different. How about an esthesioneuroblastoma? What?
Oh, that's.
Esthesioneuroblastoma.
Cortex.
So it's how close can you, what's the most you're sure of without guessing? It's benign. What else do you hear in there that you recognize? Neuro and blastoma. What does blast mean? Okay, so maybe it's not as benign as we thought. A blast is like a stem cell, right? So a blast is really an immature cell. So a blastoma might not be so benign, even though it's an oma, right? That's actually a tumor of nasal sensory epithelium, not nasal respiratory epithelium, but the neuroepithelium. Okay, so we talked about dysplasia. Remember, dysplasia is still irreversible, but it is pre-neoplastic. If we don't remove the stimulus, this is probably going to progress to cancer.
This is probably a silly question, but it's nothing to do with like hip dysplasia, right? Like they're not related anyway.
What a great non-silly question at all. So not silly, I even made a slide about it. So we use the word dysplasia to mean other things. Usually they're congenital abnormalities, and a lot of times they're macroscopic. So like we call this hip dysplasia, but is this really dysplasia by definition? No. Not really. So really a better term, if we're being technical, is dysgenesis, which is like abnormal formation. Genesis, like the first chapter of the Bible, how it all came about. Dysgenesis. We're put together wrong. It's not really a reversible adaptation, right? It's a birth defect. So dysgenesis is the better term, but you're gonna hear dysplasia because it's in the lay terms now, it's hip dysplasia. We also refer to, there are several microscopic dysplasias that you can't see grossly. And again, this is a birth defect. It often goes along with hyperplasia. So kittens with cerebellar hypoplasia often have a little bit of cerebellar dysplasia when you get down on a microscopic level, which you can't see grossly.